Hi folks, we're back with another COVID in Cobb update, for better or for worse. And I say that because the worst part is, after some declines earlier this year, we're now inching steadily back upward when it comes to COVID cases, and that's very worrisome for Dr. Janet Memark. She's the head of Cobb and Douglas Public Health. She's the person we usually talk to pretty much on a weekly basis about all this, and she tells me what's happening here in Cobb may be a trend that is really developing elsewhere.
Right now, we are sitting at 122 cases per 100,000. We've been around that area now for the last couple of weeks. So just remind everybody that that's still considered in the high transmission range, right? But definitely in a more containable state. So public health can contact everybody who needs to be contacted and have them isolate at home and get in touch with their close contacts and make sure that they quarantine. We have about 21,400 and about 53 cases right now with 449 deaths. So we have been holding at this rate for a little bit. What is concerning though at this point is that we have a lot of activity is happening around the nation, and so we have surges in multiple locations throughout the nation that are actually considered as bad or worse than the July and August surges. And so I felt like it was very important to talk to everybody because we are kind of heading into a dangerous time. We see a little bit of an uptick in our cases in Georgia, but an increase in hospitalizations as well across the state. But as the weather gets colder and people start to travel more because of holidays, as well as just adding COVID fatigue onto everything, and people are really just having a hard time continuing with the measures that we need to do, this is a kind of a time that's ripe for having a big surge ahead of us. So we're not there yet, and so this is the time that I felt like was really important to talk to everybody about doing everything we can to keep it at bay. So remembering wearing those masks and socially distancing, washing our hands, avoiding more than 10 people is what I would say in a crowd, and getting your flu shot.
All right, so these are troubling times, especially when you deal with an infectious disease like COVID-19. People are being forced inside because the weather's getting a bit colder, thinking about holidays, thinking about holiday travel at this point. And another big troublesome thing for Dr. Memark is the fact that we're seeing a higher trend in local outbreaks.
The district has been really busy lately, and as well as the county. And we've been talking with Cobb County about what we can do about this. So we've had multiple outbreaks in sporting events. Has continued to be a hotbed of activity. So it's athletic clubs and teams, and a lot of them are not even in session, and yet we're under conditioning. They are getting a lot of outbreaks, but we're seeing a lot within businesses and restaurants as well. And so I encourage people that are working in these areas, please wear your mask as best you can. I know it's hard to socially distance, but as you stay indoors and indoors more during this time, transmission becomes much easier.
Seen a lot on social media recently about the fact that, hey, we haven't heard much about the flu. There's not many flu cases around here lately. Well, Dr. Memark says that's really simple to figure out. That's been the trend basically because of the precautions we're taking because of COVID-19 is cutting down on the flu cases around here, but that does not mean you don't need to get your flu shot.
We talked previously about how in the southern hemisphere we definitely have a decrease in flu. We are seeing that here as well. So it is decreased from how it was in the previous years. But we feel that that has a lot to do with the measures that we have in place. So that we are wearing our masks, washing our hands, and trying to keep some distance amongst ourselves. Now, if we're ripe to have a COVID outbreak or a COVID surge, we're also ripe to have an influenza surge as well. So same things that keep them both at bay. And so that's why it's so critically important to get the flu shot as soon as you can. There are hospitals that around the nation are completely overwhelmed, and they have field hospitals that are set up outside of their main hospitals. And we have had that happen to us in the previous surge. And so if that happens, then we got to make sure that we do not have flu and COVID-19 that are circulating together. And it is possible to get both at the same time too. And so everything that we need to do for COVID will help flu as well.
And again, Dr. Memark wants to talk about Halloween. Halloween's always a spooky time of year, but this year it will be spooky for a different reason.
Halloween will definitely be a little bit different this year, right? And so definitely when you look at the CDC's recommendations for Halloween, the traditional Halloween is considered much more high risk. So going door to door and within a few feet of each other, unmasked is very dangerous. So we ask that people look at other things. I think the county is doing something where they have a drive-by and you stick your bag out and you get stuff dropped into your bag and everybody's protected from each other. Those kind of things, or scavenger hunts within your own kind of family unit around your house, or being able to put candy out that people can pick up that would not make them get into crowds. Those kind of things are the best. Please, Halloween parties at this point would be very dangerous. We are seeing whenever there's a gathering, there seems to be cases that are associated with that. So, and we have had one with a gathering of 100 people outside, and we got a significant number of cases from that as well. And so it's definitely happening. So please, whatever you can do to mitigate those things. And remember, don't put your fabric mask on under your costume mask. That's a dangerous activity to do.
And public health always watches the hospital to make sure they have the capacity to deal with sick patients. And so far, so good, although they see the COVID cases inching up.
So hospitals continue to be pretty busy, and so it fluctuates daily, and so we've seen some busyness within the ICU numbers and within the med-surg beds. We are seeing like a slight increase in COVID numbers in the hospitals, and so it's nothing quite dramatic, but there is a slight increase that we're keeping an eye on. So please, we definitely are seeing some outcomes of having some COVID activity, so we just need to keep an eye on that.
So, do you have it? I have it. Dr. Memark has it. And a lot of people have COVID fatigue.
COVID fatigue is very real, and it is something that I personally am battling with, as well as my employees, and we have been at this since before March, and so it's definitely a concern. The only things that I can say about that is, do the best that you can. So I know if you're going to gather and you need to have some social interaction, try to be safe about it. You can interact with people, you can have a mask on or be outside and be greater than 6 feet away from each other. It's the large crowds that are a bit of a problem right now. Let's hope this is our last push for this. So, we have vaccines that will be coming out. It looks like towards the end of the year, and we'll start off with the first tier of vaccines that will go to healthcare workers and long-term care facility people that live there and work there. And then we have in that tier is public safety and other people like that. And so we have some hope on the horizon, so try to have, this is not the time to open everything up and have all your family come in and have grandma and everybody and you got to think about our family members coming from different areas of the country that may be experiencing a surge right now. So for your fragile family members, please, this is a time to try your best to just make it a little bit longer or make it as safe as you possibly can. Can you, get into a quarantine bubble for a little bit so that, you decrease your activity, your high COVID activity, get yourself maybe tested before family members get together. Can you do some of those things that just make it safer? I mean, nobody wants to shut down the economy, shut down schools and do all these things, but we just want to make it safer so that we can all be around a lot longer.